Anthony Wright, the Executive Director of Families USA, to share some additional stories.
Thank you, and HELP, the National Health Law Project, is such an important ally and fighter in the work for justice in our healthcare system. Greetings this evening. My name is Anthony Wright. I'm the Executive Director of Families USA, the longtime healthcare consumer advocacy organization working for over 40 years for the goal of quality, affordable healthcare for all Americans, a healthcare system where health and healthcare is accessible to all, affordable to all, equitable for all, and there's few programs that help us get closer to that goal than Medicaid. And we are in a big moment right now. We're in a big moment in this country about having a debate about healthcare. And it's not, and we've had a number of these moments of having a debate about healthcare, having a debate about what, whether it's about the Affordable Care Act, whether it's about Medicare, whether it's about Medicaid. And I have a feeling that it's not just because it's just another program. When we're talking about healthcare, we literally are talking about whether we care for one another, literally and figuratively. And so these congressional fights, these conversations in our politics and in our policy matter incredibly. And so I'm happy to be here on behalf of Families USA to just, with my colleague, Jesse Cross-Call, our Senior Director of Partnerships, to also just share a few more stories for folks, because what is being proposed here in Congress, potentially in a vote in the next week in the House Energy and Commerce Committee, would be the single largest cut to Medicaid, the single largest cut to health care in our history. It would be a devastating impact on our ability to have to access health care for millions of Americans. And there's going to be a lot of talk, as I talk about these stories, there's a lot of conversation about how some of these, some will say these cuts are not going to have, impact beneficiaries, are not going to impact benefits. And we want to be very clear, and the Congressional Budget Office confirmed that today, that there's no way to make the scale of these cuts without having a real impact on beneficiaries, having a real impact on benefits, having a real impact on healthcare providers, whether it is your local hospital, whether it's your local clinic, whether it's the nursing home, whether it's the maternity ward. It's going to have an impact on individual people, on the benefits they have, the access they have to the care that they need. And they're going to talk about things in jargon that talks about FMAP formulas and provider rates and per capita caps and all sorts of language that will obscure what it's actually doing, which is cutting the core program of which nearly 80 million Americans depend on for their care and their coverage. They are going to make an effort. Number one of the things they're talking about is attacking the number of people, 20 million people who gained coverage during the expansion under the Affordable Care Act. These are low-income, largely working people, individuals, many of them without a dependent child at home, but who don't get coverage at work. And so Medicaid is literally their last option, since they are literally making less than $22,000, $24,000 as an individual, less than $40,000 as a family of four. And they are, and these are folks that don't get coverage at work, and so as a result need Medicaid as a way to get that basic primary preventive care. And So the proposals are to reduce the amount of money that the federal government funds to cover this population so that these folks are, when they go into the hospital, are getting the care that they need and are paying patients rather than uninsured patients that then are getting uncompensated care, bankrupting them, putting them in medical debt, but also putting a burden on the hospitals and clinics and providers that we all rely on. There's a set of proposals that are that. Maybe it's a change in FMAP formula, that's a cut. Maybe it's a per capita cap, that's a cut. A second category may go broader because it's just a cut to states. And it may be the way that the program is financed, like a provider tax or a FMAP formula, but that's the gobbledygook, that's the jargon. What it is it basically cutting how much money the federal government gives back to the state, often from the taxpayers of that state, to help fund their health care program, and that just forces the state to make an unholy choice between cutting people or benefits or payments to providers and thus access to the care that people need. And then there's a third category, and this was where some of the stories we'll talk about, is a third story is a category of cut is bureaucratic burdens to make it harder to get on and stay on coverage. And this could be just making people reapply for coverage, not every year, but every 6 months, every 3 months. It could mean work reporting requirements and actually penalizing people when they have a job loss that they didn't have to prove what hours they get at their gig work or other things that might be very hard, and it might be other onerous paperwork obligations. So I want to just again be clear. They're gonna when we get the details in the next few frankly days, maybe hours, we will try to translate that as much as possible, but just know at the end of the day, these are cuts to the healthcare system that we all rely on. So let me talk about some of the folks that we have engaged with at here across the country as Families USA, as one of the groups that have been for decades working to represent healthcare consumers in our healthcare system. Stephanie is a college student with a sharp wit, a love for learning, and a medical chart that reads like a novel. She is also a Medicaid beneficiary. For her family, that coverage has been nothing short of life-saving. Quote, Stephanie has five life-threatening conditions and autism, just to keep it interesting, says her mother, Lauren. She had a kidney transplant, seizures when she coded, adrenal insufficiency, and severe gastrointestinal and menstrual hemorrhaging that have been required multiple transfusions. Her care is complex and constant. Stephanie takes medications every 2 hours starting at 7:30 a.m. until 10 p.m. She receives both intramuscular and subcutaneous injections and relies on a regular pharmacy, a specialty pharmacy, and a compounding facility to get the medication she needs. She has private insurance through the disabled dependent provision, but it's Medicaid that fills in the critical gaps. Quote, even though we have what would be considered good private insurance, Medicaid has covered so many things that primary didn't, Lauren explains. I honestly don't know how we would have managed without it. Stephanie has been hospitalized over 20 times, all through emergency room admissions. Some of those hospital stays have lasted up to 4 months in the ICU. Medicaid has helped with the cost of copays, deductibles, and ongoing care. After her transplant, when her parents were taking turns during 4-hour overnight shifts to manage her care, Medicaid covered nighttime nursing so they could sleep. As Stephanie transitioned into college part-time, Medicaid again played a critical role, this time by funding the nursing support required for her to safely attend school. She also received services through the Department of Developmental Disabilities, including respite care, tutoring, a behaviorist, and a counselor. Through another Medicaid program, she receives help from a personal care assistant. Stephanie's home life has had to change dramatically too. Her medical needs require a whole house generator for climate control, a hospital-grade air and water filtration system, and a fully accessible bathroom. Medicaid and the Catastrophic Illness in Childhood Relief Fund help cover these essential modifications. Lauren reflects often on what their lives would look like without Medicaid. It's not just about the hospital bills. It's about daily survival, she says. This coverage makes it possible for our daughter to live at home, to go to college, and to have a chance at a life that isn't defined only by her diagnosis. I want to thank Lauren and Stephanie from New Jersey to share that story. I want to call up my colleague Jesse to read another story from Heather Morris from Illinois.
Thank you, Anthony, and thank you, everybody, for being here this evening. As Anthony said, the next story is Heather Morris from Illinois. Heather from Morris, Illinois. There we go. Heather Lyon lives in Morris, Illinois, a small community nestled in the heart of the Midwest. At only 39, her story is one of pain, resilience, and advocacy. I was born with a heart disease, Heather shares, and my health since birth has been a complication. Her life has been defined by medical emergencies, 2 strokes, a heart attack, and ongoing chronic conditions. Yet despite the seriousness of her health issues, Heather doesn't qualify for disability. Over the years, she has relied on Medicaid to stay alive. Unfortunately, and I say unfortunately because no one really wants to have to rely on state insurance, she says, but I'm incredibly grateful to have it. If I didn't have it, my health would decline even further. Medicaid has been Heather's safety net, especially during times when employment wasn't an option. I had Blue Cross Blue Shield throughout my job, but after that I had to leave. Medicaid was there. Trying to find employment now is incredibly difficult, she says. Heather's passion extends beyond her own experience outwardly to her community. Quote, "People don't realize how vital it is. There are so many people in this country who rely on it for doctor's appointments, for prescriptions, for their children. And if you take that away, what are people supposed to do? They'll die. Is that really what's necessary? There are single mothers and fathers trying to provide, and now you want to take away the vital pieces we need just to survive? This is 2025. I thought we had come further than this." Heather notes that navigating the system hasn't been easy, and even with coverage, accessing care remains a challenge. Trying to find doctors who accept the insurance can be a nightmare, Heather says. She explains how the introduction of managed care plans like Meridian can complicate things even further. If you get Meridian, it overrides straight Medicaid, and not all providers accept Meridian, she says. Luckily, her local pharmacy fills the gap. Jewel Osco Pharmacy in my community accepts the insurance I have, she says. I'm able to get prescriptions at no cost, which is a blessing. But potential policy changes threaten even that fragile balance. Proposed work reporting requirements could mean the end of healthcare access for Heather and millions of others. Quote, "What am I supposed to do without a job? I'd be without my medications, without my doctor visits. One of my prescriptions is a blood thinner. If I don't take it, I could have another stroke, and that might kill me." Heather doesn't just speak for herself. She's a caregiver for her grandparents, one of whom is a veteran. Quote, "If this mess continues, they'll lose their benefits too. They've lived in their home for over 64 years. I can't lose my home and my insurance." She has worked in healthcare for over 2 decades and is currently pursuing her PhD in natural medicine. She has seen firsthand the importance of programs like Medicaid, stating, "I've worked in education, mental health, and in shelters. People need these services to survive." Heather's message to lawmakers is clear and urgent. Quote, please stop this, please reconsider, because people are going to die.
Stick around, Jesse, because I think we'll trade off back and forth again. Some of these stories are coming to us from a joint partnership that we at Families USA have with Families USA, Community Catalyst, Protect Our Care, Moms Rising, and the Center for American Progress, to really make sure that we are working hard to make sure that the stories of folks with Medicaid are told. It's been great to have this crowd here and everybody who's been participating in this effort over this 24-hour vigil. We want to make sure that we continue to bang that drum. And so there is a new Instagram and YouTube channel called Healthcare Storytellers. So check out Instagram, Healthcare Storytellers, on YouTube, Healthcare Storytellers, and there's a bunch of stories on there now. And if you want to contribute to those stories, please do so, because we need to continue to tell these stories all day today, all day tomorrow, and all day for the next week and the next week. We have, as the Congress is doing this, we have 3 weeks to save Medicaid, to prevent a grievous package of the largest cut in healthcare history to be passed before Memorial Day, and we need to continue to tell those stories. So we need your stories for anybody who's still tuning in. Now, I'm going to suspect that the people who are tuning in, maybe they are watching this at midnight here in D.C., but I have a suspect that this is a more civilized hour in California. And I'm the new executive director of Families USA. I spent the last 24 years working at Health Access California. So I'm proud to read a story from California from Taylor Moss, a medical student at Touro University, who is passionate about her career as a future provider. She is also a Medicaid beneficiary who is extremely worried about losing access to her coverage. Not only is she worried about her own health care, but she's concerned for her future patients. Quote, Medicaid has so much more meaning to me too. I actually joined it thinking that this might help me have more of a connection with my future patients as someone who wants to work for the underserved. I've been lucky that my Medicaid experience has been great, but it can be a challenge to navigate. I think being on Medicaid will actually make me a better provider. But now I'm not. I'm only scared for my own health care insurance and what I would do if we lose funding, also my future patients and these people that I hope to serve. When she turned 26 last year, Taylor was no longer eligible to stay on her mom's insurance and had to look for other options. As a patient on anxiety medication, she cannot afford to have gaps in her coverage that would impact her access to medications. Through her school, included in her tuition, and there was an option for coverage, but after doing some research, she found that it would cost an approximately $20,000 for 4 years, way over her budget, as she works part-time as a $17 an hour to afford her school fees. This is when Taylor learned that she was eligible for Medicaid. After applying, she was able to get approved and covered in just a month. Not only was she relieved to have comprehensive coverage and continued access to her medications, but she was able to maintain access to her providers, keeping her care consistent across the board. She found, in talking to her fellow students, that there was an issue for many of them who switched to schools offered coverage. She also found that in those conversations that approximately 75% of her friends at the med school were also on Medicaid and are all concerned about the proposed cuts. Even with the program in jeopardy, she talked about how she looks forward to being able to connect with her future Medicaid patients about her time on the program and sharing with them how much it has benefited her. Thank you, Taylor, for sharing your story. And I think that's just another example that when people say, that I think our system is stronger when everybody is included. And when folks say, we just want the Medicaid program to cover just children or just people with disability, and I think it belies the fact that if people who are low income, people who are between jobs, people who are trying to get an education deserve health coverage. and it actually strengthens the healthcare system for everybody when they are they are covered. They're getting primary preventive care. And when they do need care, they are paying patients in the healthcare system that we all rely. And so that's why I think it's really important to continue to fight for everybody in the healthcare system and prevent cuts across the board. We're at time? So I just want to say thank you for on behalf of Families USA. Before I pass it on, I'd say this is a really important fight. Thank you for the good work that everybody has been doing. Thank you. I've been watching all day on the live stream. I'm happy to make the midnight. I'm happy to have like this Dick Clark moment at midnight on the mall, hashtag, to basically say that we need to protect Medicaid. We need to continue the fight. Thank you for those who are staying throughout the night. And let's keep fighting for Medicaid and for the healthcare system that we all depend on. Thank you very much.